Hi, my name is Erin Kenzie, and I'm from Oregon Health and Science University. I'm presenting leveraging large language models to identify acute mental health patient flows and interview data. Our team is based at OHSU, and we're working closely with colleagues at the University of North Carolina. The work I'm presenting today is an offshoot of a project funded by the Oregon State Legislature through the Oregon Behavioral Health Coordination Center, as well as Health Share of Oregon, which is one of our Medicaid health plans. In our main project, we're using system dynamics and discrete event simulation modeling to optimize investments in bed capacity for acute mental health services in Oregon. For this project, we're looking at both the adult and youth behavioral health systems, and we're drawing from patient level data sets as well as a large number of key informant interviews and input from 2 advisory panels. It's an ongoing project that has been very well received by health system leaders and state policymakers. And for this, so some premises here are that system dynamics modeling can support system level improvements to behavioral health systems, but modeling is time consuming and quickly outdated. Artificial intelligence has the potential to streamline system dynamics modeling, but specific methods have not been developed. And there's a need for AI-based approaches for identifying model relevant data about patient flows to support simulation modeling within the behavioral health domain. So the data for this AI project was some interviews conducted with subject matter experts as part of this larger study. We focused on interviews from folks at the emergency department as well as acute inpatient facilities for the adult system. And we used Python to access models, 2 models called Small LLM and Google Gemma, which were hosted on a secure internal computing cluster at OHSU. And we iteratively developed prompts containing definitions and examples of several data elements related to patient flows in behavioral health and compared AI and manual coding. And we compared, how we compared was variable name plus definition, variable name plus definition plus example to see which ones worked best. And the hypothesis was that using subject matter expertise via the definitions and examples in prompt design would enable accurate abstraction of patient flow data. So we looked at variables such as both functional and license capacity, length of stay, including treatment and boarding time, origin, disposition, reason for delay in disposition, such as being civilly committed, that sort of thing, and generic pain points. And what we found was that the variable name plus definition plus example did yield the best results with a couple caveats that I'll get to. We also found best results with instructing the LLM to first analyze a passage for relevance and then analyze for content. So like a 2-pass system. Some challenges, the transcript anonymization was time consuming. We wanted to go through the process of anonymization, even though we were using an LLM behind a firewall, because we wanted to see kind of how that would go and how laborious that would be. And we found that it was quite time consuming. And it raised questions too about how much anonymization do you need to do behind a firewall versus not behind a firewall. I think those are still some open questions. We had some administrative delays in accessing our university LLM. Prompt development has been time consuming. This is still an ongoing project. And it just has required a lot more iteration than we had anticipated. We had some issues with accuracy over repeated runs. So the LLM spitting out different things based on, the exact same input. And then some issues with hallucinated data and misused examples. So we had some issues with it spitting the example numbers back to us when we were asking for it to extract numbers from the text. So some questions that this rose was how to protect interview data without the sort of lengthy anonymization process, best practices for prompt development, how to streamline that, differences between specific LLMs that are out there, and just generally how to streamline this process to make it a net efficiency gain. So thank you very much. Here's my email address for any questions too.